what typically occurs is we will have, sanitized, washed, all of that. But then when we come into the space, if we had to navigate the environment like touching doors and stuff like that, then sanitize. So sanitizer may not be 100% perfect, but I've had big meetings even in the pro sports thing with related to less occurrences of MRSA and all kinds of stuff. So it is a thing, it works. So you come in, you sanitize. And then our first thing, now I already had it set up where we have the pillow under the belly as well as that additional towel that will create coverage on the sides of the belly. And then what is the first thing I should be thinking about? Aha! I've had to learn to just really hammer that one away because it will be easy for you to forget that, okay? And then feet up for me, please. And under. Okay, I know that is in the correct position, tops of the feet touching, but I tend to just line up what kind of seems like the peak of their heels should be in line with that bolster, and that's pretty much gets me there. And then we're to, I'm gonna mostly focus here on the methods. All of this, all the touch modifiers, okay? We're gonna simplify it. If the goal is relaxation and stress management, then slower is more relaxing than fast, okay? Any of the stuff related to rhythm, sequencing, everything, the more consistent, the more patterned and consistent. So the amount of applications, if they're uniform, they kind of follow, maybe let's say it's threes, like 3 applications here, 3 applications there, each one done at the same duration, the same, and the pressure starting from light to deep and coming back out, all of that being regimented and consistent. The more rhythmic, consistent, and slow, the more relaxing. If it's dysrhythmic and the pattern is seems all over the place, all of these factors would align with it being more stimulatory and not relaxing. And the biggest one for you is going to be slow down. Slowing down is going to be one of the harder things initially. Coming down to the methods, static methods, just holds, right? Just holds. If I'm thinking chakras, then I go to each joint line and all that kind of stuff. But my pattern tends to be, hey, get the bolster in, squeeze those heels, start thinking good thoughts. Come up, low back, mid back and low, all the way up. Just generalized contact. And I'm making it pretty robotic, but in general, this principle of making contact with areas over the sheet before draping it and massaging is a good one to initially follow. So right here, I'm gonna work on the back. So I'm gonna mostly make contact here. I could be verbally confirming with the client. Now, everything comfortable, bolsters and pillows, good. Are you warm enough? Okay, good. Voila. And then I can confirm too. All right, now I have to prepare you always for a client that is your very first time working with them, and we're going to start with the assumption they've never had massage before. So there's some verbal facets that we have to go through with that and saying, all right, as we work through, I'll check in with you a bit more, especially in these first sessions, just to confirm that pressure levels are perfect, amount of lotion, like some people like more of a stretchy sensation, others prefer more lotion, so I'll check in and all that. At any time, if the pressure's too much or too little, or if you're not warm enough, all that kind of stuff, please let me know. All feedback is good feedback. Yeah. Easy peasy. And ideally, even a lot of that could have been stated before getting on the table too. All right, now here, Compression. We've learned a lot about compression. All that kind of stuff can be done over the sheets. In this initial demo for beginners and kind of coming, the draping is going to be especially modest. So there's going to be more working over sheets in like around the pelvis, maybe a little bit near the chest, stuff like that, just to kind of show that you can effectively work. There may be times when getting direct skin access, like especially with scar tissue, would be prudent, but in many cases with your first time clients, it's better to be more modest with the draping, right? And so you may find they don't need the pillow, the towel on the sides of the body and all that kind of stuff. But start off with keeping things more modest and be as careful with the draping as possible. And then if you have to maybe drape an area, let's say there was a hip replacement and stuff like that, then you can work your way from there. All right, the tactic with draping is going to be the bunch. So note that I gather the tissue, and then as soon as I have a bunch, then I can start manipulating that without making direct contact with their body. So in general, as much as possible, and it's not like this works perfectly, I don't necessarily want my hand going underneath the sheet. So the easiest way to do that is just to create like little handles for yourself, and then I can nudge that around and I can gather it. And we don't want windows. That's going to be the other thing too. No drafts, right? So it's going to be a case where having the sheets taut on the body is actually going to be a bad thing to do. That we should, anywhere, get the sheet gathered in such a way, and more bunchy, so that it's contacting as much the surface of their body as possible. That protects you, and then they tactily can feel that they have that coverage, right? So here, even on the sides, like I pull everything in where like it's off, you know, coming from the sides of the table, all of that, and I'm good to go. And that's really the only tactic that tends to matter, is making sure you don't have these drafty spaces for air, especially keeping the sheet taut across the body. All right, now we're here on skin. And this is where, if I'm rushing occasionally, I've done an oh no and started applying lotion, but try really hard to make contact with the skin and not apply a lotion first. So no lotion, move the skin. No lotion, move the skin. I just talked about not having there we go. We can get all kinds of information here. Hot, cold is one of the bigger indicators. If an area is especially hot, then that might tell me there's some inflammation, stuff like that. The pliability of the skin. So when we get to drag is an element to one of the touch modifiers. Drag is going to be basically related to how much tug on the skin and the tissue we have. So no lotion, where I kind of stick to the skin and I can take it to an endpoint, to a barrier, and then hold it and cause more of a stretch. That's more drag. When I start applying lotion, I'm going to get less drag and I'm going to slip more. So drag is related to in terms of systems and techniques. Myofascial-related systems use less lotion, more drag. Classical massage, or like Swedish, however you want to call it, tend to use more lotion, less drag. More drag will correlate with the perception of more intensity. So the statement of magnitude isn't just about like how much pressure. It tends to kind of correlate a little bit more with just how intense the sensation or the effect on the tissue is. And a lot of that is subjective. So some people may respond well to more drag, but I need to confirm that with them, right? So I haven't applied any lotion yet, but I could check in and say, now, Does that kind of tug and stretch sensation on the skin feel good, or would you tend to prefer more lotion?
It feels good.
But I need to ask that question, just like we have to check in related to pressure. You're gonna have people where just that drag sensation is very intense and could reach a point of feeling painful. But you have to make sure that you do, and I tend to, these days, if I can, try to affect as much of the myofascial component as possible. So I use as little lotion as possible, but I have to base it on their comfort level. It's gonna be the same principle of pressure. The amount of pressure I use ideally affects at least 3 major layers, like the superficial layer of skin and superficial fascia, then the first major layer of muscle, and at least the second layer of muscle, because if I affect the second layer of muscle, that will also affect its relationship with the third layer of muscle. But then there would be times where getting to the third layer is necessary, but more pressure can be more intense, and I'm always going to have to shift based on their subjective experience as to what pressure feels safe. And some people only into that first layer of muscle, that'll be already on the edge. And so phrases are therapeutic threshold is more the kind of the defined term, but it should be we're right on the edge of it being kind of that good hurt. And that's partly what we have to clarify with the clients. Like at any time we want the sensations of like how much tug or drag and how much pressure to feel just right. Like it's doing something good, but it should not be too much or too little. They especially shouldn't feel like they're having to strain in their breathing, okay? So that's the blueprint there. Now I'm already doing gliding. So there's gonna be a moment here where I talk through all this, and then I'm gonna restart and go through just a big demo. Going into compression. So here's static. If I apply force, now compressions, now the body's not flat, right? But compressions can be such that for me it feels like I'm either pushing more down into the table, more precisely down into their skeleton. So I can apply pressure that comes down right there, and I'm focusing the pressure really as much straight down into the table. As we move out, there may be cases where I'm thinking about into the skeleton more, really squashing the tissue rather than having it getting pushed in a particular direction. So body mechanics wise, I'm here or here, and switching feet, heel down. So here's just static compression. To turn that into a glide, I have to give it a direction, all right? So you may have to adjust the angle of your shoulder, you may have to adjust where you stand. Sometimes it may feel like you have to take a little bit of a step away, all of that. Stepping closer, I feel like I come more straight down. If I make myself step a little further away, that tends to help. But that's gonna be the distinction. Does it feel like a smash or like I'm pushing it in a direction? Now, this is still a compression, but the sensation is very different. This one will feel more intense in terms of pressure. This one feels more intense related to drag. And then it'll always be just about how much force, how much pressure I'm actually applying. In either one of those categories, I could push more straight down, or I could give more of a push in that direction. If I wait long enough, I wait and I wait and I wait and I wait and I wait, you won't be able to see it, but I can feel it, and the client can certainly feel that there is movement. I am slowly going across the skin. And that is a glide, but that's going to be a very long, it's going to take a long time to accomplish that glide. In a myofascial-based system, maybe that's my goal. But we don't usually, we have to start with kind of giving you the blueprint for that relaxation-based method. So you saw that I am moving, and I shifted my body mechanics, and I could just chase this all the way down but it might take a minute or two for me to just slowly let the connective tissue and the skin allow for this motion. All right, but all glides ultimately need to be, you can't come in and try to be like you're landing an airplane, like whoosh. It has to start with a compression, and then you turn that compression into a glide. So your body mechanics, you have to compression first, confirmation of pressure. If it's light, then you know that you're just warming up the tissue. But then if you're pushing deeper, then we need to do a confirmation of the clamp. All right, we're gonna get the pressure where it's just perfect for you. Tell me when it's just right.
That's good.
Okay? Confirm the amount of pressure. Now I'm gonna try to hold that pressure, but shift my body mechanics in such a way that I turn that into having a direction to it. And I wanna try to maintain that pressure downward while also allowing it to create a force where we're actually elongating and stretching and turning it into a glide. But you gotta start your body mechanics always as a compression. Okay, even when we get to kneading, everything should be built around you remembering how to do a compression first, and then everything else happens secondary to that. All right, so that's where we get to torsion. Okay. Torsion, like a knead, is just a push, like a compression, plus a pull. But the mechanics of that push hand, making sure everything can be seen a little bit, mechanics of that push hand don't change. It's just like a compression, turning into a glide. It's just that this hand comes over and creates a counter force. It creates more of a torsion, stress into the tissue. So we'll come back around and talk about the mechanical stresses that we're ultimately putting in the tissue. And it's like, is it a compression stress? Is it a tension stress? Or is it a torsion stress? It can be a shear stress, all of this. But mostly what we're gonna be doing is using compressions, glides, and kneads, which are gonna do those major mechanical stressors into the tissue, getting hopefully the desired effect we're looking for. So, but my biomechanics, stay with the compression and glide, and just incorporate this pull. If I do anything, and there's lots of ways you can configure this, I tend to kind of start my shoulders a little bit crooked, and then when I apply more force, I set myself up to so my shoulders become aligned. So I'll here, reach a little bit, and then when I introduce the push and the pull, now my shoulders square up. And that's all it is. And kneads don't have to be super fast. All of this stuff doesn't have to be super fast. These long holds and kneads, and the torso is harder to knead, especially when you have more lotion. I need to be able to get a grip. So the limbs will be easier to knead than the torso. But the stress I'm using kneading as a method. The force I'm putting into the tissue is a torsion. I could do something like a push and pull here. This is ultimately my favorite. So I grab the traps, my pull is gonna be on the traps, my push is on the lumbar area. My elbows are straight. Right, don't get lost in it. All right, shearing. Shearing would be that I take two surfaces and make them slide on each other. We don't usually do that a lot. I may use friction and stuff. The area where that would actually make the most sense is sometimes when we're moving structures of the skeleton. So in the metacarpals and metatarsals, these long bones, there's muscles in between. I can't, chisel my way in between those. So the way that I can affect those is by moving those bones back and forth. That creates a shear stress and friction that would help those structures. But we don't tend to think as much about shearing as much.
Any other parts of the body besides the hands?
And scapulas, getting them shifted all over the place. Lots of elements where they could and various friction elements, but there's always another component coming because that's compression plus. But those, I tend to feel like what we do with shearing is related to the skeleton. And I use it predominantly in the long bones of the hands and the feet, metatarsals, and the scapulas. Good question. Elongation. Elongation is the lengthening of anything. Like I take it from this point, I made it longer. Okay? So here in the leg, more short, more long. That technically is elongation. Stretching would be using elongation but to end range. So stretching is a component of elongation, but elongation is, I could force the tissue apart like that and do something where I'm trying to make this. So I am lengthening or elongating. I think about elongation more relative to joint movement. Do I shorten tissue or lengthen tissue? But it does not necessarily mean I need to stretch it. Stretching of joints, like taking the arm, the leg, any of those components to end range and holding it, I'm gonna try to show you as much as possible how to limit causing additional stresses into the joint line and more into the soft tissue spaces in between. But elongation, there you go. Stretching is elongation, but also just joint movement. As long as you're making it longer, that's elongation. Oscillation. Oscillation is underappreciated in that we can do things that are more soothing. Incorporating a rocking element, all right? It's a whole vestibular, inner ear thing related to rocking, right? If it works for a baby, it still works for an adult, okay? But it has to be what? Rhythmic and slow. By go to sleep. That's not gonna work. Shaking, though, can be a huge sensation load into the tissue without it having to be pressure-based, okay? So if I want to signal these sensory receptors with good intention and all this stuff to shush, right? Sometimes just flooding the area with sensation is a tactic, like those thumper guns and all kinds of stuff. Or you're doing contrast, temperature. You're just flooding the area with sensation and trying to get, if it's related to pain, the pain-related receptors, the nociceptors, to just to calm down. And I could do that with, it has to be rhythmic. If I make it dysrhythmic, then it might be more stimulatory. But if I oscillate an area, even though the frequency and rhythm is faster, if I do this for long enough at the same rhythm, then the tendency is for the body to basically give in to the stimulus. That if this was tight and the calves were kind of just locked in, that repeated shaking, there's a whole distribution of hyaluronic acid, lubricating fluids between tissues, all of that. But there's also a nervous system component where everything gets flooded so much with sensation, eventually it kind of goes, I give up. Now it's not perfect, but shaking can be a really good assessment approach. And just thinking about what that's doing, I'm actually moving the tissue on the skeleton itself. And what's that doing? It's traveling all the way up the body. I'm getting like little tiny effects on the hip joint. I'm getting effects into the spine and the pelvis and the sacroiliac joint. I'm affecting the ankle, the knee, all kinds of cool stuff. And all the tissue, the more it's moving, thus the more we're actually potentially accomplishing. So this one's the easiest of trying to just figure out how can I get this. Or I could do things like actually grab a hold of the tissue. I could do it right over the sheet, and I'm using this hand to then shake. Right? Now, it could be like that. It could be like this. Those are all principles of oscillation. So shaking and rocking. Shaking and rocking with intention. Percussion. We looked at the sum, or I could use, depends on what part of my body I use. So, hacking, punching, I don't know if it's actually called punching, but whatever. What I use the most is typically, I don't tend to use this kind of system. But in classical renditions of massage, you may see a thing where it's, all right, I'm gonna drape, glide, 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 knead, to both. Okay? If you were going to incorporate this in a session, it would make most sense to me to do the massage without deportment in prone, and at the end of prone, come in and do, this is kind of a wake up signal. And it is a sensation, right? So if we're flooding the body with sensation to create a desired effect, maybe this could be seen as another one that could affect maybe a perception of chronic pain or something like that. I tend to use it more for if I can identify that certain muscles aren't functioning appropriately, then I might use it to wake a muscle up, all right? So I don't use it kind of more in that blanket way, so you probably won't see in my demo me use deportment just because, right? I try, and I hope that you try to use these things with intention. The one that so beyond that, beyond sometimes like figuring out how I could signal a particular muscle to wake up, the cupping for respiratory stuff. So create as much of an air pocket with your hand as possible. And then, but if you do that, and we're thinking upper respiratory stuff, it could be everything from they're getting over an upper respiratory illness, maybe there's some chronic asthma, stuff like that. Cystic fibrosis, this gets used in the medical world. Even nurses will be taught to try to clear the lungs. And so if you're gonna follow a pattern that's good for everybody, it's wherever the ribs are, you're good. And then start low, work up. So low, and you gotta create a shock wave. Okay, low. Now wait. I know it sounds aggressive, but with the air pocket, it's creating more of that clap. But that's creating the shock wave into the body. Now that brings me to one other point, is being aware of where they are and where especially your legs in your lower half are, okay? You have to get mindful of this whole hitting them with your leg. You gotta try to avoid that as much as possible. If there's anywhere where a misconception occurs here, it's the therapist walking around, making contact with their arm and hand with the lower part of your body. So don't do that. And also here, being mindful of, like, if you have to, creating a pillow barrier if you have to get close or anything, or just getting your arm in the way, all these kinds of things. We have to be mindful that what they should perceive the contact being is here. That's it, right? Movement. Movement's easy. That's movement, but joint movement. And as a quick sidebar to what we're discussing, if there's swelling here, what is gravity now doing? Now it's downhill, rather than when we're standing up, we'd be fighting gravity. So if I bolster a person, that's affecting fluid movement. They're out of gravity, and with the bolstering, I'm creating these gradients and hills for the fluid to naturally follow. The more joint movement I do, okay, the way your body moves lymph, the way it moves venous blood, is through the shape changes of soft tissue, which squeeze on the vessels and create those pressure effects. So either here in between, that's how that fluid is being moved, or at the individual joints, there's a capsule and there's nodes and everything in there that when the shape change occurs here, and that's pumping. And all those vessels ideally only allow fluid to go one way. Doesn't mean it can't go still, but they have flaps that only allow the pressure to go in one direction. So arteries don't do that. They have a heart that's a mechanical pump, pushing everything in a particular way like a hose. Everything else, though, needs more of a bellows. Needs some kind of an action to get that to occur. So I can argue that as much as I incorporate joint movement in a session, okay? Right now, I am doing lymphatic drain. Right now, I am doing venous blood return. Right now, I am thinking about the joint capsule and ligaments of the ankle joint. All of it has the potential to help, and it's combined. It all is affecting all of that. If I want to make a arthritic knee have more synovial fluid so the cartilage is more lubricated, I do this as much as possible. Rhythmic joint movement, not to end range, but that's how I affect the synovial membrane that actually lubricates cartilage. Okay, just this. This is also how I do lymph drain. This is also how I help pump blood. So if I have a secret trick, it's that, no, watch your body mechanics. Don't hurt yourself or put more effort in than you need to. But as much as you can move all the joints of the body in a rhythmic fashion that's just incorporated in the massage, and you're getting all this extra potential for benefit, right? And it just turns into, if you can, incorporate as much joint movement as possible. And that just ended up being probably the biggest reason why I saw success with even a lot of like the complex people, is just because it's doing a little bit of a lot, not hyperfixating on doing just one thing. Okay?